Chief Exec, Lucy, is Rebecca here? I can't seem to see her. She's not. Okay. Please just send my warm regards to her to say thank you for giving me this opportunity, because it's an opportunity I don't take lightly. My work with the stroke service in King's College Hospital, London, and then North Bristol NHS Trust have kind of exposed me to the problems stroke patients face, the relatives, and also doctors as well. This topic today, blood pressure is a very important topic, and I'm glad you chose this topic because there's something we can actually do about our blood pressures. We can all control our blood pressures. And so it's really a very important topic. I'll try as much as possible to explain I might have to use some medical terms, but you don't really need to worry yourself about some of the terms I'm going to use. But the most important thing is to get the overview of measures that we can take to actually reduce the reoccurrence of stroke, or even the occurrence of stroke in the first instance. The starting point should actually be defining what blood pressure is, because everybody talks about blood pressure, but many people don't really know what blood pressure is. And so I think the starting point will be to define what blood pressure is. Lucy, I'm having a bit of a problem with the screen. Okay.
It's moved on. Thank
you. Yes, thank you. So blood pressure can be defined as the force of circulating blood on the walls of the arteries. So there are two components to blood pressure. You have the first reading, which is what we call the systolic blood pressure, which is usually the higher reading. And then you have the lower reading, which is the diastolic blood pressure, which is usually the lower reading, the denominator. And the systolic blood pressure is defined as the pressure your blood exerts on your artery when your heart is beating. And that's usually the higher pressure. And diastolic blood pressure is the pressure or the force your blood exerts on your artery in between heartbeats. So when the heart is resting, and that's why it's the lower blood pressure. Now, when is someone diagnosed to have high blood pressure? So you have, if your blood pressure is 120 millimeter mercury and less, and or the diastolic of 80 millimeter mercury or less, you're deemed to have normal blood pressure. It's said to be elevated if it's between 120 to 129 millimeter mercury systolic, or an 80 millimeter mercury diastolic. You're deemed to have high blood pressure depending on actually where you are. The American Heart Association uses a lower value, but I think I'm just going to stick to the NICE guideline, which is what applies here in the UK. They seem to have taken a higher value. So you're deemed to have high blood pressure if your systolic blood pressure is above 140 millimeter mercury, and or your diastolic is above 80 to 89, or 90 rather, for NICE UK, 90 to 99. So you have three stages. So stage one is what I have just described. And stage two is when your blood pressure is higher, systolic, higher than 160 millimeter mercury, but less than 180 millimeter mercury, and your diastolic blood pressure is higher than 100 millimeter mercury, but less than 120 millimeter mercury. That would be stage two blood pressure. And then stage 3, which is deemed as hypertensive crisis, is when your blood pressure is more than 180 millimeter systolic and or higher than 120 millimeter diastolic. That's when you really need to call your doctor as soon as possible. Now, there are 2 types of high blood pressure or hypertension. So it could be primary or essential high blood pressure, or it could be secondary. So primary is more common than secondary. Primary, more often than not, we don't know what caused it. So you have about like 90% of people that suffer from blood pressure are under this category. Secondary hypertension is usually caused by a problem, either in the endocrine system or the vascular system, or some medication can cause secondary high blood pressure. But we know that there are some factors that apply to both types, whether you're suffering from primary hypertension or you're suffering from secondary hypertension. There are some factors that we can mitigate. And these factors include high salt diets, smoking, excess alcohol, high cholesterol, stress, obesity, and chronic inflammation. I'll take this one after the order as we go along. And now we need to understand the pathophysiology. How does blood pressure cause stroke? And why does it matter that we discuss this and discuss how we can regularly control our blood pressure? So uncontrolled blood pressure will cause either hemorrhagic or ischemic stroke. So hemorrhagic stroke is when the pressure in your blood vessel is so high that it ruptures one or two of your arteries in your brain, and that can cause bleed into the brain. That's hemorrhagic. It can also cause ischemic stroke, which I will discuss in a few minutes. High blood pressure uncontrolled can also cause heart attack. It can cause kidney failure. It can cause heart failure. It can cause eye problem, hypertensive retinopathy, and it can also cause cognitive decline. PRESS is a mnemonic for posterior reversible encephalopathy syndrome. You don't need to worry too much about those terms, but it basically is a reversible condition that occurs when blood pressure is not controlled. Patients becomes very confused, and sometimes they can actually mimic a stroke. But the good thing about it is it can easily be reversed. So once you control the blood pressure, things get back to normal. However, when left uncontrolled long-term, it could actually cause small vessel disease that sometimes could lead to vascular dementia. So how does high blood pressure cause these problems? So if you look at the vessel on your left, you see the normal vessel, the normal caliber. Just imagine your vessel as being your garden hose. Obviously, your garden hose carries water, but your vessel carries blood. And we know that blood carries oxygen and nutrients to your cell. Now, your normal blood vessel is meant to be expansile. So when blood is flowing, it's meant to expand and allow maximum flow of blood to your cells, taking nutrients, oxygen to your cells. What high blood pressure, uncontrolled high blood pressure does is, over time, it thickens the wall of the vessel. It thickens the wall and is no longer expansile. And it also leads to damage in the interior, in the lining of the blood vessel. And then that allows fats to accumulate and form what we call plaque. As the plaque grows, it exerts pressure on the lining of the blood vessel, and that could rupture, what we call plaque rupture, and cause blood clot formation. So when it ruptures, platelets aggregate there and they form blood clots. Platelets are blood cells that are responsible for blood clots. So if you cut your skin, for instance, it's platelets that come to seal it up and initiate the process of healing. So when this happens within the blood vessels, there's a blood clot forms within, and then the blood clot could be dislodged, and that's what causes the problem. So if it goes to the brain, that's when people have stroke. If it goes and blocks any of the arteries in the brain, that's when people have stroke, because obviously they're no longer, that part of the brain is no longer getting oxygen, is no longer getting nutrients, and so what we call an infarct. They have dead cells there. That's when people have stroke. If it goes to the heart, that's when people have myocardial infarction, heart attack. Now, it's very important that everyone here should be able to spot when someone is having a stroke. We have a mnemonic FAST. So F stands for facial weakness, A stands for arm weakness, S stands for speech difficulty. Either the patient or rather whoever is involved has slurred speech, or they are having word finding difficulty, what we call expressive dysphasia. If you spot any of these, that's the time to call the ambulance. That's the time to call 999, because every second matters a lot in how much of the cells can be redeemed. Having spoken about that, what can we do to reduce or manage high blood pressure? There are a couple of measures we could take to keep our blood pressure within the acceptable range. Now, if you're already on a tablet for high blood pressure, it's advised that you take your medication regularly. There are different types. They are classed differently. You have the S inhibitors. S stands for angiotensin converting enzyme inhibitor, an example of which is ramipril. You have the angiotensin receptor blockers, an example of which is candesartan. You have the calcium channel blocker, which is a popular one, is amlodipine. You have the thiazides, the diuretics. You have benzoflumethiazide. You also have indapamide in that class. You have the alpha blockers, doxazosin, and you have the beta blockers, bisoprolol. And you also have those that are centrally acting. The thing with this is no two individuals are the same. So you have some people who respond quite well to a particular class of antihypertensive, and you have some people who are resistant to them. You also have some people who find it difficult, or rather don't tolerate some of these classes. So it's for your GP to then look at your history, look at your comorbidities, and decide on which antihypertensive is best suited for you. So there is really no hard or fast rule about it. It just tailored to individuals. But it's really important, even if you discover that you're developing side effects from your blood pressure tablets, it's advisable that you see your GP as soon as possible to look at other alternatives. That's the pharmacological management. But there are some steps we could take as well to lower our blood pressure. And that's classed under lifestyle modification. And that has a lot to do with you eating what you eat. And I was talking about food later, because studies have shown there are actually some type of food that will aggravate blood pressures. And there are some type of food that will help lower our blood pressure. And it has to do with inflammation. There's some food that promote inflammation and some foods that are anti-inflammatory, because studies, research, everything I'm discussing here is based on scientific research and outcome. Low salt, for instance, salt is an osmotic agent. So too much salt in your bloodstream will cause water to pool into your blood vessel and increase the pressure. And so it's advisable that when you eat low salt. It's not advisable to actually use table salt on your food. Cook with it, but try to restrain yourself from using table salt. Now, it's very important again to exercise regularly, because when you exercise, you release endorphins. So endorphins are feel-good hormones. They have so many health benefits, and they also have been found to relax the blood vessels. They also counter the effect of stress hormones like cortisol. So endorphins have been found to counter those effects. Now, it's important also to rest. It's advisable that every adult has at least a minimum of 9 to 7 hours rest in the course of 24 hours. Avoid smoking. Smoking, as you know, cigarettes have nicotine, and nicotine have what we call, they are agonists for adrenergic receptor agonists. In other words, they promote the release of catecholamines. Catecholamines are things, hormones like adrenaline, noradrenaline, and those will cause high blood pressure. So it's advisable to, if you're smoking, to aim to quit smoking. And then alcohol as well, excess alcohol. Now, alcohol in moderation, I think this study was done with red wine, has been found to be cardioprotective. So just say maybe because a glass of red wine with your dinner and nothing exceeding that. So excess alcohol causes the kidneys to release renin. Renin is a hormone that converts another hormone, angiotensin, to angiotensin 1. And then you have angiotensin converting enzyme converting angiotensin 1 to angiotensin 2. It's that pathway that ramipril works on. It blocks angiotensin converting enzyme. That's why it's called angiotensin converting enzyme inhibitor. So angiotensin 2 has two functions. It causes vasoconstriction of your blood vessels, and it also causes sodium and water retention, because it stimulates the adrenal gland to produce a hormone called aldosterone, which is responsible for sodium and water retention. Obviously, when you're retaining sodium, like I explained to you, sodium is salt, basically. It's an osmotic agent, and also you're retaining fluid. It increases the pressure in your blood vessels. And so that's how alcohol causes blood pressure. Another thing alcohol causes is dyslipidemia. Dyslipidemia is alcohol causes your liver to produce the bad cholesterol, the bad fat, the low density lipoprotein. So obviously you have good fat and you have bad fat. The good fat is the high density lipoproteins. And I'll talk about that a little bit later. And the bad fat is the low density lipoprotein, which alcohol stimulates the liver to produce. Again, the next one will be avoid stress. I can almost hear somebody asking me, how can you possibly avoid stress? Because we live in a world where you meet with stress every day. But there are a couple of steps you could take actually to avoid stress, because when you stress out, you release cortisol, which is a major stress hormone, into your bloodstream, and that is not good for your blood pressure. Sometimes when I'm going to work and I see people rushing, particularly during rush hour, I see people engaged in road rage. Well, if only they knew what they are doing to their blood pressure, they would take life a lot more easier. I try to leave the house much earlier to avoid the rush. That way, you beat the traffic, you save time, and you go to work in a very relaxed environment. And also, it's important that you control your weight. Obesity has also been implicated in hypertension. And the scientists have told us that in obese people, their leptin level, which is another hormone, is very high. And leptin increases the risk of high blood pressure. Now, I don't think my presentation today will be complete without discussing the role of inflammation in disease. So further studies are beginning to show us that inflammation causes most of the medical problems we have. Now, you have acute inflammation and chronic inflammation. Now, inflammation is actually the body's natural mechanism, defensive mechanism against infection. Acute inflammation can actually cause some harm, like we are seeing in COVID-19. That is actually what causes the deaths in COVID-19. It's not the virus itself. What happens is the virus stimulates the immune system, and it's been found that some people actually produce these inflammatory cytokines in excess, what we call cytokine storm, which is why we now use things like steroids when patients come in with COVID to kind of calm the storm, because steroids are anti-inflammatory. Now, when the inflammation is chronic, it has also been shown to cause some damage to the blood vessels, arteries, the nerves, intestine, and it could lead to high blood pressure, heart diseases, diabetes, some certain cancers, some bowel disease. And like I said, I think in Harvard, they did a study on the role of inflammation on diseases, and also looked at the different type of foods, the food that are pro-inflammatory and those that are anti-inflammatory. And they came up with a few of this. And now the foods that on the right are mostly anti-inflammatory, and the food on the left are mostly pro-inflammatory. So it's advisable that we eat more of the green, the food on the right, than those on the left. Sugar is a major culprit. Sugar is really high in pro-inflammation, a very high pro-inflammatory food, and it causes this in so many ways. For blood pressure, sugar has been found to counter the effect of nitric oxide. So nitric oxide is produced by our blood vessels to dilate the blood vessel and so reduce blood pressure. But sugar counters the effect of that. And so it's implicated in high blood pressure. It is also implicated in development of bad fats, the low density lipoprotein, because sugar gets converted in the liver. Excess sugar gets converted in the liver to triglycerides, which fall under the bad cholesterol. So it's something we need to avoid. And then fat, I already discussed the role fat plays in plaque formation, and it's also pro-inflammatory. It has also been found to be implicated in diabetes. Fats causes insulin receptor resistance. It blocks the receptors, and so the cells don't get enough insulin. So it's important we cut down on fat. So these are the anti-inflammatory foods. Primarily, they are mostly greens, vegetables, fruits. Berries are really very strong. They have very strong antioxidants. I think the fruit I probably need to highlight is red grapes. Red grapes got a strong antioxidant called resveratrol. Resveratrol is the same agent you have in red wine. So red grapes contain that antioxidant, which you also find in red wine that's been found to be cardioprotective. So you don't necessarily have to drink red wine to get your cardiac protection. So red grapes, for instance, is a good alternative. And for good cholesterol, fish is a very good source. Olive oil is a very good source of good cholesterol. That's your high density lipoprotein. Now, while we are talking about cholesterol, I'll give you the nice guideline. The nice guideline says that our cholesterol level we should all aim to get our cholesterol, the total cholesterol, to be at 3.5. High density lipoprotein, which is the good cholesterol, we should aim to get it above 1.6 millimole per liter. and the low density lipoprotein, which is the bad cholesterol, we should aim to keep it below 1 millimole per liter. I'm happy for Lucy to later email this chart to everyone. Okay. And so that brings us to we are actually what we eat. And so it's not just what you eat as well, it's how much of what you're eating are you eating? Are you conscious of your weight? It's really very important because, like I explained before, obesity is a major risk factor for high blood pressure. And so everyone needs to know their BMI. And their BMI is calculated in weight in kilogram divided by height in meters square. And you can see the ranges. Below 18.5 is underweight. That means you probably need to eat more. Above, between 18.5 and 24.9, you're within the normal BMI range. And you're deemed to be overweight if your BMI falls between 25 and 29.9, and obese if it's above 30, between 30 and 39.9. That means you need to take some steps to reduce your weight. A very important factor is exercise. Exercise, like I said, is really very good. Exercise actually improves your blood circulation as you exercise, and also you release endorphins as well when you exercise. Now, you can see the people in that picture, they are laughing, they're enjoying what they're doing. So when you exercise, and don't subject your system to stressful exercise, just do something that you enjoy. Now, they're getting double for their trouble. Why? Does anybody know why? Because they're laughing as well. They're enjoying what they're doing. And like I told you earlier, when you laugh, you release endorphins. It's the same thing you release when you exercise. So they're getting double for their trouble. And actually, on that note, I would like to congratulate the Chief Exec of Bristol After Stroke, Dr. Healy, for successfully completing the 10-kilometer marathon on Sunday. So it's no mean feat. I think she's led by example. I think we all should borrow a leaf from her. We may all not be able to do 10-kilometer marathon, but the little we could do, even if it's just taking walks in the evenings, taking fresh air, hanging around friends that bring out your positive, friends that make you laugh, and avoiding things that put stress to your system, that will really go a long way. So I think laughter, probably, which is cheap, is cheap, you don't pay anything for it, is everybody's advice to actually laugh. So I'd like to end on that note. Thank you.